The skin is our largest organ of the body, with its most pivotal function as a protective barrier against mechanical, thermal, and hazardous stresses. It protects from external assaults and prevents transepidermal water loss, or the process of water evaporating from the skin. Ichthyosis is a group of more than 20 genetic disorders, the common link being an increase in transepidermal water loss, as well as an impaired barrier that is susceptible to external pathogens. In comparison, healthy skin is hydrated with a waterproof, intact barrier. Ichthyosis is a genetic condition that affects all races, genders, and age, and is classified as non-syndromic, affecting just the skin, and syndromic, that affects other organs of the body as well as related to other disorders. Depending on the type of ichthyosis may present at birth or within the first year of life. Some forms of ichthyosis may also have delayed onset and be related to disease. As ichthyosis is genetic, there is no cure. Ichthyosis presents as thickened or sometimes paper-thin, dry fish-like scales on the surface of the skin, often in addition to inflammation and redness. This redness and inflammation is most noticeable on exposed areas of the body, especially the face. Ichthy, meaning fish in Greek, refers to the visible fish-like scale, a result of the body either producing too much stratum corneum, the body's outermost layer of the skin that we can see and touch, or the stratum corneum failing to shed properly from the skin's surface. This causes a build-up of skin cells, resulting in this dry, scaly appearance of the skin. To give some perspective on the amount of scale, normal skin renews every 28 days. Skin that is affected by ichthyosis does this every single day. While the scaly, reddened skin is an element of the condition that is most visible, affecting both syndromic and non-syndromic ichthyosis, syndromic ichthyosis can also have an invisible effect. This is involvement of the internal organs. Depending on the genotype, this can also lead to a loss of function of other organs. This can include an inability to control body temperature, whereas sufferers of ichthyosis can overheat and be prone to heat stroke. People with ichthyosis do have sweat glands, but due to the thickness of the scale, this sometimes does not allow the sweat to reach the surface of the skin to cool them down. Other issues can be an impaired hearing when scale builds up around the ear canals, ectropion of the eyes, a tightening of the skin around the eye area that may inhibit the ability to close the eyelids, that can lead to dry eyes and in some cases corneal damage. In some types of ichthyosis, such as Netherton syndrome, hair also may be involved, with hair having a very brittle or no hair, including eyelashes and body hair. All forms of ichthyosis can lead to a limitation of movement, with some areas of the body being very painful to move due to the tightness of skin from the build-up of scale. As the barrier is impaired, the smallest of cuts and abrasions can lead to infection. This often requires antibiotic treatment and in some cases hospitalisation. The removal of the scale is essential for the skin's barrier to function as normal as possible. Due to the fragility of the skin, small knocks can cause these splits in the skin and require extra care. Daily treatment is essential in relieving the symptoms of ichthyosis. This can be time-consuming and costly. The first-line treatment is the removal of the scale on a daily basis, sometimes twice a day. This includes soaking the skin for 20 to 30 minutes and vigorously removing the scale from the entire body, face and scalp. This can be very painful if there are any infections or broken skin present. Salt baths may be required during times of active infections. After this, a thick layer of a paraffin-based ointment is covered over the entire face, body and scalp. This may be done 3 times a day, depending on how severe and the type of ichthyosis that is present. This is to protect the skin against transepidermal water loss, as well as protecting it against any invading pathogens to prevent infection. Due to an inability to regulate body temperature and wear sunblock, as much of the skin as possible will need to be covered in long-sleeved clothing and pants, even in the warmer months of summer. It should also be noted that the increase in scale produced by someone with ichthyosis requires energy. It is therefore important to increase calorie intake to ensure that there is no nutritional deficiencies. Thank you for listening to this presentation. If you would like more information on ichthyosis, go to firstskinfoundation.org or visit your GP or dermatologist.